Discover everything about hip replacement surgery in this video, including the reasons for surgery, different types of hip replacements, pre-surgery diagnosis, the surgical procedure, potential risks, and the full recovery process. A hip replacement is a surgical procedure that includes the removal and replacement of portions of an injured hip joint, either with an artificial joint or implant. It is aimed to relieve extremely severe hip pain and stiffness caused by hip arthritis and to improve function. The implants used in this procedure are as follows. The stem, which is made out of metal, either titanium or cobalt chrome, is inserted into the thigh bone. The ball, which is usually made out of polished metal or ceramic, fits on top of the stem. The socket is a combination of a plastic liner and a cobalt chrome or titanium backing. Hip implants generally last for around 13 to 15 years. After this time period, the patient undergoes another surgery, which is known as hip revision surgery. Reasons for hip replacement surgery. There are several conditions involved in hip degeneration, thereby making hip replacement surgery necessary. These include osteoarthritis, osteonecrosis, in case of disrupted blood supply to the ball portion of the hip joint, resulting mainly from a dislocation or fracture, the ball might collapse and deform. You might consider hip replacement if you have persistent pain in spite of medication, worsening pain in the hip while walking, inability to climb stairs, difficulty to rise from a seated position. Types of hip replacement surgery. The three major types of hip replacement are total hip replacement, partial hip replacement, hip resurfacing. Total hip replacement, most commonly performed hip surgery, which involves worn out or damaged areas of the hip being replaced with artificial implants. During the procedure, the doctor inserts a stem into the patient's femur for stability. The head of the femur is replaced with a ball made up of metallic or ceramic alloy, and the natural socket in the hip joint is replaced with a durable plastic cup. Hemi-hip replacement, hip hemiarthroplasty. This procedure involves the removal and replacement of the patient's femoral head only. It does not replace the socket. Surgeons typically perform this surgery in old age patients to repair certain types of hip fractures. Hip resurfacing. Hip resurfacing helps to relieve pain from cartilage loss. It involves resurfacing of the femoral head and socket, most commonly performed in younger patients. Diagnosis before hip replacement surgery. The diagnosis of patients requiring this procedure is mostly symptom-oriented, which includes pain, loss of range of motion, and functional impairments in activities of daily life. Apart from those certain special investigations like X-ray, CT scans, and MRI is carried out to know the exact level of damage involved. Hip replacement surgery procedures. Hip replacement surgery can be performed in two ways, namely traditional hip replacement and minimally invasive technique. Traditional hip replacement. During traditional hip replacement, the patient is given anesthesia at first. The doctor makes an incision along the side of the hip and dissects the muscles to expose the hip joint. After this, the ball portion of the joint is removed by cutting the femur with a saw. Then an artificial joint is attached to it using either cement or uncemented implants that allows the remaining bone to attach to the new joint. The doctor then prepares the surface of the hip bone by removing any damaged cartilage and attaches the replacement socket part to the hip bone. The new ball part of the femur is then inserted into the socket part of the hip. A drain may be put in to help drain any fluid. The doctor then reattaches the muscles and closes the incision. Minimally invasive hip replacement. In the minimally invasive approach, doctors make 1 to 2 incisions from 2 to 5 inches long. The same procedure is performed through these small cuts, as with standard hip replacement surgery. The small incisions are mainly aimed to limit blood loss, ease pain after surgery, shorten hospital stays, reduce scar appearance, and accelerate healing. Risk associated with hip replacement surgery. Generally, hip replacement surgery does have a very good prognosis. However, like all other surgeries, This also has some risks associated with it. These are as follows: bleeding infection, blood clots in the legs or lungs, injury to associated nerves, fracture, dislocation recovery. After hip replacement surgery. Recovery after hip replacement surgery starts immediately, and the patient is encouraged to get up and move around as soon as possible after surgery. 6 to 8 weeks of intense physiotherapy regime is required by the patient to improve muscle strength and range of motion. If you're considering hip replacement or any kind of hip surgery, reach out to Medworldindia.